This is Maggie Monyi. I will be talking about my stakeholder educational plan today. And this project will be dwelling on the different stakeholders that are involved in my clinical scholarly project, their role, the education, and the ways in which they will implement the change among the elderly population with depression. My clinical scholarly project is the use of music therapy as opposed to using only antidepressants among the elderly population 60 and above to decrease suicide rates and depression symptoms in a nursing home setting within a 3 months period. This will be dwelling on music, and the reason why I choose this population is because most of the time in long-term care facilities, older adults face unique challenges that may stem from degenerative brain and body issues, major life changes, and unfamiliar situations, which it may be difficult to cope with. Because of the loneliness that may result from the moving to a new home or losing a loved one, older adults tend to draw into themselves at care facilities. Older adults also they experience they also experience isolation as their children or loved ones may not be able to visit frequently because of their busy schedule. For some families, it is often easier to place older adults in care facilities than to worry about their well-being when they live alone. This isolation of older adults reflects the Americans' cultural inability to realize the best means to integrate the aging into general society. And this is the reasons why all these people suffer from depression. Music therapy is defined as the use of sounds and music within and involving relationship between an adult and therapist to support and encourage physical, mental, social, emotional, and spiritual well-being. Depression. What is depression? Depression is a common psychiatric disorder with symptoms including low moods, low energy, poor concentration, loss of pleasure, poor self-care, and low self-esteem. And all this, it makes the older adult to withdraw into themselves and they lost interest in the things they usually liked before. In this project, I'll also be looking at the different stakeholders that are involved in the project, which are providers, psychiatry nurses, and myself, facility administrators, social workers, music therapy, certified nursing assistants, and the participants who are the patients 60 years and above. Who are stakeholders? Stakeholders include those individuals, group, or organization which either affect or are affected by the action taken when conducting music therapy for people with depression. These stakeholders have some roles to play in the clinical scholarly project, and what are they? Providers, which are made up of psychiatrists and psych NPs, their role is to help to screen patient or subjects for the study. They find a practice that has been used in the past, which is antidepressant in this case. They evaluate and document project interventions and medication that has worked for them in the past. Psychiatry nurses, what do? They administer the antidepressants. They schedule patients for their next dose and music sessions. They educate participants on how the project will be carried out. Facility administrators are made up of supervisors and the managers of the nursing homes. Since the project is a performance improvement project and implementation, then the administrator will need to approve the project at the facility. Administrator, they receive the entire cost of implementing the project. They provide safety for the participants. The office managers make sure all phone calls are answered. They demonstrate support of the project, financial and administrative resources. They make sure that there are adequate necessary supplies to complete the project. Social workers, they contact patient family outside the facility, and they make sure the patient and their family are working in collaboration. Music therapists are most of the time, they at least have a bachelor's in music or are certified in music. And most of the time, they lead all the participants involved in the project in the music sessions. They identify the kind of music they like and prepare for the music sessions and the type of music that the participants had liked or liked in the past. Certified nursing assistants, they help to transfer patients to attend their music therapy. They take vital signs and document the vital signs for the participants. And they also help to pass snacks and drinks during their music sessions. Participants, which are patients 60 years and older, they must be diagnosed with depression and must be at least 60 years of age. They must sign an informed consent and also have a co-signer that they trust to co-sign behind them. Depression is one of the common mental health problems experienced by the elderly and has been found to lead to increased mortality and suicide rates in this age group. So we'll also look at how the stakeholders, how their role affects this clinical project. Another thing is we'll also have to look about how which theoretical framework is used. And in this case, the theoretical framework that was used is the Pepler theoretical framework. And Pepler theoretical framework was an interpersonal relationship in nursing theory, and it was originally identified as a conceptual framework. Pepler proposed 3 phases, namely orientation, working, and the resolution phase, and 6 nursing roles in the nursing-patient relationship. In the Pepler phase, you have the orientation, the working, and the resolution phase. In the orientation phase, it is when the provider, the nurses, and the patient, they come in contact to build that trust and rapport, to ask questions and to clarify issues. And in this very stage, it is when they outline criteria and are established, and they plan a care to be formulated. They have a time limit for interaction and visits, and which are all clarified and agreed upon. And in this stage, there is a termination stage outcome and behavior are considered. In the working phase, the major therapy activity occurs. This is when, after they have taken the symptoms of the patients, now the nurses now act as counselors and advocates to these patients. Specific problems are to be addressed and outlined. So providers commit to work on specific problems that require immediate attention. Client takes responsibility for behavior and actively work towards the change. They identify and they use available resources available for them. In the resolution stage, the relationship comes to the close where provider helps prepare clients and situation for termination. The providers and the clients reduce interaction time. The client function money independently. There is mutual agreement between the providers and the client regarding resolution issue. Needs are met and resolutions of issue are summarized. Follow-up instructions are given. Client has health maintenance plan, which in this case it is a music therapy. And in this music therapy stage, the music is being held twice a week for 3 months. And most of the time, it is held after breakfast and sometimes after lunch, probably between Wednesdays and Thursdays, depending on how their schedule is for the week. In this project, we also have the implementation phase. How will this project be implemented? In the implementation phase, the stakeholders will assess the need for change in practice. I will have to schedule a meeting with each stakeholders, present my project to them and the importance of this project to the stakeholders. I'll include previous music therapy study among depressed elderly patients. Tell them the current statistics. In the meeting, I will educate the stakeholders on the use of music and how it should be run. The first meeting will be held with the facility administrators. They manage and they supervise general administrative charge of the facility. They ensure that the nursing home facility are in compliance with all applicable requirements of federal regulations. They oversee and supervise the staff, making sure that the patients are safe and well taken care of. The second meeting will be held with the providers and the psychiatrists and nurses with the CNS. And in this meeting, providers will help to report and evaluate the symptoms that the participants report at the beginning of the project and at the end of the project. I will also need to notify the psychiatrist that the patient is a participant of my project. Another meeting will be held with the music therapist who supervise and implement the music therapy to make sure that it is done correctly and properly. The last meeting will be held with the participants of the project who are the most important part of the project. I will tell them the importance of actively participating in the project and that the music sessions or therapy will take 3 months for completion. They are the most important people in this project because they determine the success and the failure of the project. The response and records that will be recorded during the music therapy will later on be analyzed. Normally, what happens is that elderly population sometimes, because of the side effect of the antidepressants, they sometimes don't like to take antidepressants. So sometimes taking it with doing it with music or just music by itself kind of help to reduce some of the symptoms. Music has proven to elicit emotions in elderly population. It also reminds them of their past and what they like. For example, those who like a particular kind of music, when they listen to it, it brings them back to old memories, which help to reduce depression rate and suicide rate. This project is a cost-saving study to both the patient and to the government. It will lead to the reduction in suicide rate. Those are the benefits of the project. There will be reduction in suicide rate, there will be death rate reduction, death expenses, decrease in depression symptoms, reduction in disease as a result of depression symptoms like blood pressure and heart rates. They will also help to increase the quality of life and long life expectancy. Music has become a valuable resource when working with the elderly in nursing facility and has been utilized for many years to reduce agitation, stress, and depression. The use of music showed positive outcome for residents in nursing facility and should be considered for implementation as part of normal culture within such facilities. Normally, we always make sure we use all the evidence-based practice that has been put in place. Thanks for listening to my presentation. If you have any questions, I'll be ready to answer them. Thank you.